The purpose of this meeting is to share information about encumbrances and expenditures, contracts that have been awarded, changing needs in the community, and projections of future need, and to engage the public in a debate about how future coronavirus aid, relief, and economic security CARES Act grant money is spent. Diane, do you want to call the roll?
Yes, Madam Chair. Councilmember Dunaway.
And
Councilmember Days.
Here.
Councilmember Gray. Don't think I see Councilmember Gray. Madam Chair, you have a quorum.
Thank you so much, Diane. So this committee takes official notice of and admits into evidence all St. Louis County ordinances and resolutions. Good morning, everyone. It has been a few weeks since we last met. There were some Treasury Department changes that had an impact on how our budget was going to look. And we've got a lot to cover today because it has been so long. We'll learn more about those guidelines I just referenced and what the reallocation of that money may mean for the delivery of our care services. But before we get into the county CARES presentation, for the usual updates in humanitarian, public humanitarian health, and economic rescue buckets. And I want to talk a little bit about national landscape and how counties around the country are faring in these unprecedented times. I think it's important for us to remember where we are and how we got here. And I think there's a lot that we need to be thinking about and preparing for in the coming months. Per the National Association of Counties, state and local governments are spending money from the CARES Act quickly and widely. Around the country, these funds are going to pay first responders, support families and small businesses, and purchase medical supplies, among other things. State and local governments are creating innovative ways to support our residents within Treasury's limited guidelines. And here in St. Louis County, we have and continue to what I perceive to be innovative programs that are supporting our most vulnerable citizens. These types of programs are going to need to continue. They're going to need our prioritization as we continue to face economic hardship amidst these unstable infection rates of COVID. The economic downturn last quarter showed the largest quarterly drop recorded since the government began publishing the statistics 70 years ago. Around the country, local leaders continue to worry, as we do here in St. Louis County, how devastating the effects these economic conditions are going to have on our revenue and our ability to deliver the needed services. This crisis is nowhere near over, and we will see today that nearly all of our CARES money has either gone out the door or has already been allocated and is going out the door. We need to be very focused on ensuring that we are able to find resources to continue providing services, or we are going to be making some very tough choices in the coming months. On that note, I'm going to pass it over to you to go through your presentation. It's all up.
Okay, thank you, Madam Chair, members of the committee. My name is Cora Walker, and I am the Chief Policy Officer for St. Louis County Executive Dr. Stan Page. I am going to go ahead and share my presentation this morning, if you give me just a moment. Okay, I'm just going to go ahead and get started and just go through. So as Councilwoman Dunaway said, we are here. It's been about 7 months since we had the very first case of COVID-19 in Missouri, and we've certainly worked very diligently over the course of the past approximately 6 months since the CARES funding, the coronavirus relief funds, came directly to St. Louis County. And so just as a reminder, the real sort of overarching mission for us in making determinations about how to prioritize and invest those funds was to try to be strategic and also make an immediate impact, focusing on public health, humanitarian, and economic investments, as well as supporting local governments. So just to review the big areas or buckets where we and the county executive decided to focus on prioritizing the funds. At first, there were the three kind of big buckets around health and public health, which is really aiming to save lives, the humanitarian relief that was aimed at trying to help St. Louis County residents meet their basic needs, specifically needs around food, health, food, housing, shelter, those sorts of just basic needs. Economic recovery, so supporting local businesses and the economy. And then we also set aside monies for municipal relief, so the local governments that are located in St. Louis County, as well as allocated and set aside money for our own response within St. Louis County government. So just as a reminder about how we broke down the $173.5 million in funds that St. Louis County received directly through the CRF, about $51 million was allocated to health and public health, as this is a public health crisis. The majority of the funds went to that. But additionally, we put about $55 million, so $24.1 million for humanitarian relief and another $24.1 million for economic recovery. We also put $47 million for the 88 local municipalities that are located within St. Louis County to provide financial assistance for their costs that are related to the COVID-19 response and recovery within their own municipalities. And then finally, about $16.5 million was allocated to county employee and constituent safety. We did update that number as the municipal relief program came into shape, and we determined that with the approximately $69 per person that was allocated to the 88 municipalities through the municipal relief program, that the St. Louis County employee and constituent safety response should be updated with that same $69 per capita number. So we're coming to around $21.4 million for St. Louis County's specific response within the county government. And we'll be talking a little bit more about kind of where we are with that momentarily. So I wanted to just give a couple of brief programmatic updates. Again, we are going to start with the health and public health response because this is a public health crisis. And as I always like to do, I like to just ground us in the numbers and where we are. We are nearing, if we haven't already surpassed, 25,000 total cases in St. Louis County. We've lost over 800 lives, and it's just really to just think again about the fact that we've only been dealing with this for about 7 months now. That really is a pretty staggering and sobering number. That said, St. Louis County has certainly led in its efforts and public health responses, and so we are certainly seeing a trend downward or just steady when it comes to hospitalizations as well as positivity rates right now, or for the week of September 20th through September 26th, we saw a 5% positivity rate. So we are certainly continuing to trend in the right direction. I'm going to talk a little bit about some of the key areas that the public health response is targeting. So PPE obviously is one of the big areas that we are trying to invest in, the Department of Public Health is investing in. To date, about 2.6 million masks have been distributed in St. County, and there is an order outstanding for an additional 1 million masks that will be available to folks in the community and throughout St. Louis County. The Department of Public Health has really worked very closely with a multitude of community partners to try to make sure that masks are distributed out into the community. And so these are just a couple of examples of some of the work that's gone on over the past week or so, or actually over the past month since we've last met as a group. So you'll see that there's an assortment and a variety of religious organizations, of working with county departments, with libraries, with community organizations. So really just trying to collaborate with folks in and throughout the community. Additionally, as part of the work around the community PPE destruction, St. Louis County has partnered closely with Prepare SL, and as this is October, they are in the process of working to coordinate outreach around Halloween, just in an effort to increase awareness about safety protocols and the importance of wearing masks for the purposes of lowering the possibility of transmission throughout the community. The next area around the public health response really relates to expanding access to community health and mental health. And this area was focused on a couple of different places and identified a couple of different priorities that were really guided by the community and directed really through the participatory budgeting process, where we engaged, or the Department of Public Health engaged the community and worked and heard from them about the areas that we should be focusing on. So over the course of the past month or so, $1.8 million has been directed to 16 different agencies with the goal of expanding access to mental health and behavioral health services. And so that includes things like counseling, psychiatric care, substance use disorder treatment, which, we've heard that a lot about just an increase in substance use and throughout the pandemic, and then also recovery services. But there's a real goal and emphasis on trying to increase service delivery through telehealth and that sort of mobile service delivery to try to meet people where they are. In addition to the $1.8 million to expand access to mental and behavioral health supports, there's also $1.7 million that was directed to 5 agencies specifically around expanding healthcare services. So expanding provider services, working to try to make sure that people are able to better access services by either by improving technology, by helping people get to and from providers, and then also by providing childcare. One of the organizations that was funded included in their proposal an effort and a proposal or an initiative to support childcare services while people are coming to receive their healthcare services. There's also efforts around providing copays for prescription drugs, and then free or no-cost flu vaccines. Again, as we've heard, it's really important for folks to get their flu shots this year if they're able, just because it can help people from getting sick, and also make sure that we don't end up in a situation as the months, as we enter into winter and December and colder months, of overextending the hospitals that we have here in the area. So $1.7 million has gone to the 5 different agencies for the expansion of these healthcare services. Additionally, another $180,000 was directed to 5 different organizations with the goal of distributing PPE. and other supplies around like masks, gloves, hand sanitizers, and the like, with really a focus on high-risk populations such as the elderly as well as in the general community. And so what we will do once this is over is the Department of Public Health has put together briefs that breaks down all of these different organizations and really gives a little bit more detail about what the specific organizations are going to be doing and kind of the programs that they're going to be advancing with this funding. And so we will be sending that once the presentation is over. But I really want to just highlight the map here that shows where we are working on targeting the resources and the funds. Based on need and based on what has been observed and what we have seen as the areas in which COVID has really had a disproportionate impact on the community, the services that the community and mental health grants are supporting are really targeted to those priority zip codes in North and South St. Louis County. In addition to expanding access to community health and mental health services, there is also an effort to engage and educate the community, again, about the importance of mask wearing, the importance of social distancing, the importance of hand washing and hygiene, and really just, again, focusing on the areas and targeting the areas of the community that are in most need. There has been a campaign, I mentioned it in either the last Oversight Committee or the one prior, where, actually, let me make sure folks, where that it's around approximately $100,000 and getting messages about, again, mask wearing and the like, and Metrolink stops, bus shelters on the radio, etc. Now, finally, the area in which DPH is really focusing on as we are moving forward over the next couple of months is around the public health infrastructure and really working to both build out and increase lab capacity, as well as thinking ahead and into the future, into 2021 as well, for the purposes of really shoring up and bolstering the public health infrastructure. As we are all aware, the CARES, or the Coronavirus Relief Funds, expenses must be incurred by December 30th of this year. And so DPH is really taking a look at the sorts of investments that need to be made still before the year is out that really can help bolster the public health infrastructure, especially as uncertainty continues to grow about the likelihood or the possibility of a second or additional round of funding from the federal government. So DPH is really taking a close look at what else is needed in terms of building that public health infrastructure and ways in which they can be sure to capitalize on the funds that we currently have as we prepare for COVID next year. Although the CRF funds are required to be incurred or expended by December 30th, COVID is certainly not going to be going away. And so we are trying to do what we can to think long-term as well as part of our recovery. So with that, I will stop so that I can answer any questions that folks might have around public health.
Madam Chair?
Councilwoman Days.
Okay, thank you. May I ask a question here?
Yes, of course, please.
Okay. All right. Cora, I want you to go back to the numbers. I missed the last part of your, looks like you said $21.4 million was for something. What was that? That's on page 6 of your presentation. And
Yes, so,
and this should all add up to 173.3. Is that correct?
no. So I've got the budget that's there at the end. We've still got approximately $5 million that has been unallocated, and that's part of that unbudgeted reserves. And so I'll be talking about that, and I've got a more detailed breakdown of the numbers.
So the numbers
later on in the presentation.
So the numbers you've given us here should not equal 173, because the way I counted it, it's more than that. But you said that that's incorrect. That you have $5 million more in reserve. Is that correct?
In unbudgeted reserves, correct? Yes.
Okay. All right. Let's go to the public health update. That's on page 10. I want to know, what do you mean by kits? Are these the testing kits that the county has distributed, I guess, to Murchison, Flow Valley, these places? Are these kits provided by St. Louis County?
Yes, so these are the PPE sort of kits that were put together that includes like the hand sanitizer, the masks, that sort of thing. Yes, and they are provided by St. Louis County.
These are not tests, in other words, these are not tests.
Yes, that's correct. That's not referencing the testing kits.
Okay, so how much of the testing has been done in these particular areas? I'm interested in districts 1 and 4, and how many tests, actual tests, have been done in these particular areas as of this date?
I will defer to Spring and the Department of Public Health to see if they can provide that information.
I will see what I can do to pull that up. There are all of the tests that we provide directly in the health department, as well as all of the other tests that are available from other community providers. So I will see if we have a geographic distribution of the tests. We do have how many positives cases are in each area, but the total number is on display on the dashboard. I will check on the total number of provided tests.
Okay, so you can tell how many were positive, but you have to go back and look at the total number of tests that have been provided. And I'm really interested in what St. Louis County's initiative is on this. And I know we have had other private entities, Athenia, et cetera, that have done testing, but I don't think that is sponsored by St. Louis County. Is that correct?
It is now sponsored by St. Louis County.
Correct, yes.
We've given $2 million, a little over $2 million, to the FQHCs to continue doing testing in North County, Athenia,
Okay.
Peoples, and CareSTL. And then we do also testing at our John C. Murphy site. And then we do pop-up testing sites that we are also paying for, predominantly in North County as well. We've done a few all over the county, but we do focus the majority of them in North County as well. So we pay for our own test kits, and we pay for the partnership services that we have now with the FQHCs, and then some of the additional access from the participatory budgeting process as well.
Okay. So, and again, on that page, down at the bottom, you're looking to do a cleanup. Can you explain to me what is that? And then it says that for opportunity to distribute PPE, is that through your department as well, Spring?
So Prepare STL is working with Wellston to organize the overall event, and we are participating by providing PPE during that event.
Oh, okay. All right, got it. Thank you. Okay, where is the, I know that we gave money to WashU, St. Louis U. I don't know if that was for contact tracing or what. Can you tell me what is going on with that project? How much were they given and what were they supposed to be doing?
So Washington University is primarily contracted to do the prevalence study. So that is ongoing. People are being called to participate in that. And that is still ongoing. So that is not the results. That is part of the, I think it's $1.7 million from back in the beginning. Actually, we started it before we even had the CARES funding. So the study is in full swing. Recruiting.
Wait, did you say 7 million? I'm sorry.
1.7.
1.7, okay.
And then we did engage with St. Louis University as well with a $600,000 contract. They are working with us on some of our internal processes, building out online curriculums for contact tracing, building out and working with us on additional data supports for our case investigation and contact tracing process. And also some opportunities to partner on some apps that we've put together for people to do some symptom tracking and participate in contact tracing. So they have a wide variety of things that they are assisting with as well. And that contract.
Are they training the contact tracers?
So we've been training them manually with our own staff with a curriculum that we built out quite a while ago. They are going to help us move that online so that we can move more people through the training process faster. And they are going to help build some booster training for people who have been doing it for a while and as things change so that we can keep that online as much as possible and minimize, how many people have to engage in the training in order to complete it.
So this will be going on after December 30th?
No, ma'am. This will all be completed before December 30th. And then we will be able to use those materials for the entire time. They're building it for us. It will be our system. So we'll be able to keep the system next year.
Okay, we have, you have 1.8 here to 16 agencies. I did hear you mention, Cora Faith, that you will be getting reports from these agencies. Have we had any kind of feedback? This is about 7 months now. Have we had any feedback as to the effect that these agencies have had, and what kind of results have we seen from collaborating with these, particularly in the behavioral health area? Sorry about that.
I will check on the progress for where each of them are. They all have monthly reports that they have to submit as part of the process of documentation that is required for CARES funding. And so those should be beginning to roll in. So I will check and provide an update on the scope of the services and how they're doing on their delivery.
And I just want to add that it's been 7 months, but we've just begun to engage many of these agencies over the past month or so with this specific amount of funding that was the community and mental health funding.
Thank you for that.
Yeah,
I appreciate
that.
that.
Yeah, so we're still probably in the early beginning to see results and being able to analyze them.
So the last thing on this particular page had to do with the your delivery of healthcare services, and I believe I asked at the last whenever we met the last time about the comorbidity issues, and were we trying to address any of those? I was told no at the time. However, I do see that you're going to be looking at something to the telehealth and mobile service delivery. Is that going to be part of that?
Yes, ma'am. That is what some of the providers talked about. That was what their proposal was. And so,
okay, so we will be addressing some of the issues, and as we know, and we all know that part of this and the reason it's affecting my community the most is because of these issues. So I don't know why I was told the last time that, that wasn't necessarily what was happening, but that's okay. I appreciate the fact that we are looking into those and trying to get people to get to primary care physicians, however, whether telehealth or telemedicine or whatever. But we're trying to get those in there so that we can decrease the comorbidities, and hopefully it will not impact my community as much as it's had been. If we go to the next slide on 12, we're looking at the influenza vaccines. Are you going to be doing those in conjunction with the testing at that time? Is that possible so that you can, as you are testing people, they can get their flu shots at the same time?
So we are already doing some of those events at the health department. This funding for other agencies they have also chosen to do some different, there are all different kinds of things that we have funded, but the health department, you can make an appointment for both. It isn't always in the same line because it is a bit more difficult to do that way, but we are doing both events that you can get a flu vaccine and get a COVID test here at the health department.
Right. Because if transportation is an issue, you're not going to get a test, then go home and then come back later and get a flu shot. So that's why I'm trying to make sure that everybody, you can get everything you need at one shop, in other words. Okay?
Yes, ma'am. That's it.
I think that's it on that particular public health thing. I think that's all I have, Madam Chair. Thank you so much.
Thank you, Councilwoman Days. And I'd also like for the record to reflect that Councilwoman Gray has shown up. All right, Cora. Oh, Councilwoman Gray. You've also got a lot of echoing going on, Councilwoman.
Sorry about that.
All right, Cora, I think the floor is yours then.
Thank you, Madam Chair. So the next area that we are targeting and will focus on is the humanitarian relief. And again, this was designed to really help St. Louis County residents meet basic needs around food, housing, and the like. So just as a quick recap and overview, for the first sort of large area for the humanitarian relief, we focused on 4 priority areas. So housing stabilization, homeless prevention, where approximately $7 million was awarded. Senior and homebound services in the amount of $827,000. Social and emotional well-being of children in the amount of $500,000, and then finally technology the amount of about $1 million. Now, regarding the housing stabilization, homeless prevention, the Department of Human Services staff is meeting weekly with the United Way and the awarded organizations for Q&As on Mondays and Tuesdays. And we are receiving reports, or beginning to receive reports, from the agencies and organizations that were funded beginning last week. Now, there has been some discussion over the past couple of weeks, just with the efforts of trying to clarify certain financial assistance restrictions that had been contemplated by some of the awarded organizations. And we've worked with them, and DHS has certainly worked with them to help them understand and really modify some of the restrictions that they had originally put in place, or again, like I said, we're contemplating, because we really want to make sure that the funds are getting out and getting to the people that are in need. Now, one of the things that I did want to highlight with this specific area of housing stabilization and homeless prevention is the equitable distributions of funds. So as you all will likely recall, a couple of months ago, we had a presentation from Molly Metzger at the Brown School about the index that was put together with the goal of making sure that the humanitarian funds are targeting, again, the areas that are most in need. And so as part of this risk index that was developed, there were approximately 10 different variables related to both health as well as economic risk that were analyzed to make recommendations about where the funds should go in St. Louis County. And based on the initial reporting that we are starting to receive from the agencies that have provided rental assistance as of last week, we are on target with the recommendations or the recommended sort of areas of targeting for the HERE 10 index. As you can see, again, just based on the 10 different variables that looked at things like poverty rates, unemployment rate, in terms of economic factors, asthma, just the premature death rate, in terms of the health risk factors. The Group A, the area in which the funding should be targeted in the amount of 60%, is right at 57%. Group B is a little bit higher than the targeted area at 37%, but still right around that. And then finally, Group C is on track as well at about 6%. So we are encouraged to see that the funding is going in the areas and in the direction of St. Louis County that is most in need, based on this really sort of objective scientific study. And so we're going to continue to monitor this as we move forward. But that is something that I wanted to bring to the committee's attention. So moving on to food security, again, one of the very first sort of responses that St. Louis County was able to operationalize was around food security and really funding areas, funding organizations and agencies that were providing food and meals to families throughout St. Louis County. And so these are the 5 that were originally funded for the 12 or so weeks over the course of the summer months. And so that has, that funding stream, the initial funding stream for food security has expired. And you can see here, again, just the areas in which the food was distributed based on some of our initial reporting that we received. Again, because of the importance of food and just the need that really exists in the community, there have been contract amendments that are in the works to extend food funding for agencies to provide food support for the rest of the year. And we are working with St. Louis Area Food Bank and Operation Food Search again, as well as adding 2 additional partners, HOSCO, which is going to be focused on seniors, and then the St. Louis County NAACP. Moving on to the Domestic Violence Fund, again, I just wanted to update everyone that there were 11 providers who were selected for funding in the amount of approximately $550,000. The contracts are going to be going out this week, but the agencies are going to be required to complete their risk assessments, which is something that our county counselor's office and our legal advisors have recommended to ensure that we are above board when it comes to compliance and reporting that we, as St. Louis County, as a prime recipient, will have to do to the OIG. So that is moving forward as well. I wanted to take a quick moment to just provide an update about the Digital Equity Initiative. So again, just as a reminder, this is a breakdown of the hotspots that were allocated by public school district in St. Louis County, as well as the Chromebooks that had been allocated to public school districts in the county as well. We certainly heard the feedback from the council and the committee about the gap or the need between the Chromebooks and the that we were originally prepared to acquire, and the need that was conveyed to us by the school districts who participated in the survey that was originally released. And so there were a couple of adjustments that were made based on that feedback and some feedback that we've heard from others in the community as well. So there was about $1 million out of the $4 million that was allocated for the Digital Equity Initiative that was put into reserves originally. And so $100,000 of funding was provided for scholarships to give tutoring services to unique learners by the Miriam Learning Institute. As you recall, the Digital Equity Initiative included a subscription to tutor.com to provide virtual tutoring to all students. But again, we heard from the community that there are unique learners and folks that have that learn in a unique way and have unique needs. And so we put $100,000 of funding for the need-based tutoring services. Additionally, the remaining $900,000 was allocated for the purposes of purchasing an additional 4,000 Chromebooks. So in addition to the 2,500 that were originally ordered for the project. And so that helps to close the gap a bit between the need that was expressed through the survey that the schools participated in earlier this year, and then what we were originally prepared to acquire. But as most folks in the country, there is a supply chain challenge, but we are, and the library is continuing to move forward with acquiring those just as quickly as possible. And so we will continue to move forward with that. Finally, the Child Care Relief Program continues to move forward as well. There have been, as of last Thursday, 55% of all of the awardees have received their full disbursement up front. And there are contracts that are still going out this week to finalize the remaining for the final 30 child care providers. Additionally, there's going to be a second webinar that is going to be provided to the providers around reporting, because one of the things that we have learned over the course of really these 6 months and working with many of the agencies and small businesses in the community is the reporting requirements that are associated with the federal funds that we've received can be cumbersome. And so we're trying to do what we can to make sure that we provide support to the folks who have received the funding from us, so that we can make sure that we are doing what is proper and necessary for reporting and compliance to the OIG and the federal government. Again, just as a reminder, the maps really just, I think, do a good job of illustrating where the need is and where the funding is going, and the work and the efforts around really trying to target the areas in St. Louis County that are most at need. So, or most in need. And so with that, I will stop again and answer any questions that folks might have.
That's me, Madam Chair.
Councilwoman Days, the floor is yours.
Thank you. I want to go back to page 18. You mentioned, and I'm speaking of the housing stabilization, and this is probably a general question for everything. What is the, as you engage these various not-for-profits or organizations, what is your maximum administrative cost in all of these? Hello?
I'm sorry, I had to unmute myself.
Okay.
If I remember, yeah. I'm sorry?
Yes, I'm
listening. Okay, yes. Well, I'm gonna be sure to get this, but I think it was 5% if I remember correctly in administrative costs.
So that's the maximum that
Correct.
Any organization can take for administrative costs. 5%.
I do believe that's correct. I will we'll make sure to verify that. But yes, if I recall correctly, it's 5%.
And the second thing is, you mentioned something about some kind of restrictions these folks had. Can you elaborate on what kind of restrictions or were they implementing that you thought, I guess, were unnecessary, and you kind of nixed that?
Oh, okay. So it's 10%, not 5%. I thought that sounded low, but yes, it's 10% of in administrative costs. And so we had heard from your office, Senator Days, as well as folks in the community, that there was no more housing support that was being provided by St. Louis County. And so I'm not entirely sure how that was being conveyed to clients by the agencies, but we had heard it from a couple of different places. And so just following up with the DHS staff, who has these weekly meetings with the agencies that were awarded, we were able to just make sure to clarify what our goals and priorities were in St. Louis County, which was to get the funding out of the door. And so the restrictions that were originally being considered or contemplated have certainly been modified. Again, I want to go back to the map that shows the Harry 10 index, which is the need-based index for rental assistance, et cetera. And you can see that in terms of the number of households that we're trying to target and where we are with that. But I do want to just thank you for letting us know what you were hearing, so that we could make sure that we were able to clarify with our partner agencies and organizations what our thoughts were around what they should be doing in terms of providing support.
Well, yeah, to be clear, the information came from an agency that said that as they were looking to do that they were told that St. Louis County was out of money. in that particular area, in housing, and so that's why the question came to you: was that true? And if so, because we had not heard that in our meetings that we have had, is there still money in this bucket?
Yes, and so we'll go into that here in a little bit. There is still some money that is available and unallocated, or that has not gone out yet. But it's relatively small in comparison. I think it's about $1.9 million.
Okay, and the other thing is that there, I will say that of the programs that you have put forward, the child care is probably the only one that I have not heard that the money is not getting to the people. I'm still having conversations with people with getting this small business relief out, but I have not heard from any of my child care facilities that they have not received. So that's good for you. Now,
it's even better for them.
Right. Well, let me also ask you that, and with this housing stabilization, is that mortgage relief as well?
Yes, it's my understanding that it's rental assistance, and it can be mortgage assistance as well.
Okay, and I guess the agencies are aware of that mortgage assistance is also included in this bucket.
Yes.
Okay. All right. And again, and this is going to be a theme throughout, I want to make sure that we have a report from these folks, a report from the food, because we're still having a significant food desert in my area. And so I want to make sure that we have a report from all of these people as to how much they've given out, what has gone on, and where they are to this date. So I think that we can give the money to the agencies, but I think it's an incumbent upon us to make sure that the money is getting to the people and the places and whatever that it's supposed to go. So that's why I'm going to continue to ask about reporting back from these different agencies and not-for-profits that you all have utilized.
Absolutely.
Okay.
Absolutely. As you see here, like I mentioned, we have started getting reports as of last week for all of the agencies that were awarded under this Humanitarian Relief program, as well as the food security. And the funding agreements that have been executed and entered into between St. Louis County and these partner agencies includes a requirement that reporting is provided even down to zip code level data. And so we are going to have all of that, and we are continuing to collect that so that we can make sure that we're targeting the right areas that need to be targeted.
The two additional partners that you have, I'm not familiar with HOSCO. What is that?
It's HOSCO, and I can certainly we can provide you with an overview of their
I just want to know what organization. What is this?
I have no. I don't know. I don't think it. I don't think it's an acronym. I'm not sure what it stands for.
Okay, so you can send us some information on who they are.
Yeah, absolutely.
Okay. All right. Well, that's it for that one. Thank you, Madam Chair.
Councilman Tracus has some questions, but I do want to check in with Councilwoman Gray first, make sure she's good. Okay. Hearing nothing, Councilman Tracus.
Thank you, Madam Chair. Good afternoon. Walker, thanks for coming.
Good morning,
I wanted to ask you some questions about your digital equity initiative. I believe it's on page 26 of your presentation.
Yes, sir.
So if I understood you correctly, the focus of this initiative is to provide tutoring for what you call unique learners. And can you be a little more detailed exactly what type of tutoring you're providing?
Yes, so I can, I sent it was included in the memo that was sent out a couple of weeks ago, but I can resend it. It basically is scholarships to support the tutoring services of unique learners it's by the Miriam Learning Center. So, yes.
So this tutoring is designed to accomplish what? Is it focused on information technology usage? What is it focused on?
Yes. So because of, and as part of the digital equity initiative, part of the funding that was allocated was for the virtual tutoring services that all St. Louis County students could participate in. But we heard back from the community as well as from a couple of folks on the council about the fact that not everybody could access just virtual tutoring that was provided via the tutor.com services, and there was other virtual tutoring that needed to exist for these unique learners, these special needs kids, and so that is what this is targeting.
Okay, and the access is exactly what I wanted to ask you about. The $900,000 for the purchase of additional Chromebooks, is that addressing the access you're talking about? The students didn't physically have the computers to access the online tutoring?
Yes. So the overarching program was for the tutoring services, for the hotspots, and then for the actual Chromebooks itself. And so, just as a reminder, we did the survey of all the school districts and schools in the area who were requesting funding, and there was a much larger request than what was originally allocated. So I think 2,500 Chromebooks were originally allocated. And so hearing the need from the community and recognizing that there was about $1 million that was remaining, and also hearing from you all on the council, the library decided to use the additional recommended that we use the additional $900,000 of funding to buy those Chromebooks so we can address access issues. Okay. So that's for everyone. That's not just for the unique learners. It's for all of the schools that were participating in St. Louis County.
I wanted to follow up on your mention of hotspots. Has your administration considered and studied internet access with respect to accessing tutoring? And by that, I specifically mean, have you studied throughout the county the ability of students to have effective internet access?
Yes, so the library has certainly been an engaged partner just throughout the area and the region for hearing about this, just what the barriers and gaps are in terms of people being able to access virtual tutoring, online tutoring. And they are collecting that data as well as part of this digital equity initiative. So again, we are putting the money out into the community and requiring that we get data about how it's used, kind of where the needs are, because the real goal is that the next round and the next time we can be even more targeted in our funding in our area, so in our focus. But we are getting that data in. We've not studied it yet, but that data is being collected for the purposes of looking at.
Well, I'd like to ask that you supply the council with that data. Sure. As we receive it. And then finally, would you agree with the general premise that while tutoring and the provision of hardware is great, if a student doesn't have the ability to access the internet, none of that matters?
Absolutely. Connectivity is a huge issue and a huge challenge. I absolutely agree with that.
And so this is the data you're working on now is the internet access or connectivity, as you say?
That is part of it, yes.
Okay. Well, I'm looking forward to seeing the data. Thank you. Thank you, Madam Chair.
You're welcome. Cora, I have a follow-up question. How much are our hotspots closing that gap between the kids who can and can't access the internet?
Again, we will be able to get you that data. I'm sorry, I've got a little feedback here. Yeah, we will be able to get you that data. What we know is based on the survey of all of the schools who participated in this digital equity initiative, is that we were able to provide a hotspot to every student that needed one based on the results of that survey. And so we will be able to really see, once we are getting that data back in and the library is getting that data back in, we'll be able to get to an answer to your question about just how effective the hotspots were at addressing the connectivity issue. But we know we were able to get hotspots to every student that needed one in St. Louis County, again, based on the results of that survey.
Thank you.
Madam Chair?
Oh my gosh, like 3 people jumped up at once. Let's see Councilwoman
I'll
Chairwoman
yield
Clancy's
to
hand go up
Councilwoman
first.
Gray, if that's okay. She's on the committee. I'll yield to her.
Thank you. Is that okay, Chair?
Yeah, go ahead.
The Chromebooks, which school districts did not, well, it may be easier, or which ones did get the Chromebooks, whichever is easier to respond to.
I've got that table somewhere. I don't have it right in front of me, but I can get it to you. Again, the library broke down just based on all the schools that replied, what their need was, and there was a community review to figure out how to allocate those. But I can get that information to you all.
Yes, I know there were some schools who declined and didn't need them. That's why I was asking. And also with the domestic violence fund, I'm assuming, I don't know if the word hired would be accurate, but I assume that you procured people to provide counseling.
Oh yeah, so we so the domestic violence funding went to agencies and organizations that work in the area of domestic violence, and so some of them were actual counseling providers directly. Others had proposals around helping women or victims and survivors get safe and get to safe places and those sorts of things. And so we just provided the funding to the agencies directly through this fund. There's also some additional funding that was allocated to the Weinman shelter just as a county shelter, but that's part of our overall county safety, constituent safety, and county employee safety area. So that's kind of the internal St. Louis County response. But for this particular area, that $550,000, that went to the 11 agencies or providers in the community.
So these, and I know this is the usual process, these are established agencies.
Correct.
Yes. And I have one more question. The food security, I noticed that the libraries reinstated the lunch program. They had stopped for a while and reinstated. Did they stop because they didn't have the funding, or was there a different reason why they stopped? Or do you know? You may not.
I'm not sure, but I can get that answer.
That's okay. I can call it.
Okay.
We can call the library. I'll leave it there.
Madam Councilwoman,
Councilwoman Days, and then we'll go to
Yes.
Councilwoman Clancy. Sorry.
Yes, I think it might be, I'm looking at page 26 here, and the Miriam Learning Center. How was that particular center determined to address the needs of the challenged learner here? I'm sure we have others in St. Louis that might be able to do that. So how was this particular center selected?
So this is a recommendation that the library and Children's Services Fund made. So it was based on that recommendation.
So the special school district was not considered, or did you only have to utilize private entities?
Well, the special school district, I think, might have been a little bit different because they are a school district. But I will let Emily Koenig with Children's Services Fund maybe get on and talk a little bit more about the Miriam Learning Center itself.
Sure. So the Miriam Learning Center is an organization that has been providing these on-site during the pandemic on-site tutoring to unique learners. So those individuals with disabilities. So the special school district is a school district, obviously, and have their own resources and caseload. So this would sort of fill the gap between what the special school district is able to provide and what the Miriam Learning Center will be able to provide. So they, their recommendation is to provide these scholarships. Students can receive up to 2 hours of tutoring per week. And for over the time period beginning, I believe it's next week through the December 18th. So it'll be provided during the school year. So it sort of fills a gap between what they're receiving potentially through the special school district already and where they might see need, separate from their school environment. So again, I think this was looking at those individuals who don't really respond to sort of online learning, virtual learning, in a way that really, enhances their educational experience. So looking at where, kids are at home, they're learning through Zoom and other virtual platforms. And this is really kind of helping fill that gap.
Is the Miriam Center the only center of that kind here in the St. Louis area?
I believe, to my knowledge, but we can certainly look that up. But I know that this is something that they do, but to my knowledge, this is the only program of its kind within the region.
But that has been the concern of many parents who have special needs children, that learning through the computer is not advantageous to them. And so I'm glad to see we're doing this, but I'm not sure what the capacity is for the Miriam Center. And I'm certainly know that probably all of the students who are in need are not getting the necessary tutoring that they do need. So, okay, I appreciate that. The other thing too is I want to know, initially we had a survey from the school districts regarding the Chromebooks and what they thought their needs were. And so if you're telling me that we needed to purchase 4,000 more, then there was some disconnect with, I guess, the survey and what they actually needed. So yes. Can you explain that?
Well, yes. So basically, we made the estimation, or we estimated the amount of hotspots and Chromebooks that were needed based on another survey that had been done around the digital divide a few months ago. But with more and more schools who were at the time of this, the announcement of this funding, it really coincided with schools that were making decisions about virtual learning versus in-person learning. The need for the Chromebooks was a lot more than the need for the hotspots was indicated in that sort of preliminary survey that had been done a couple of months ago. So it was just the reality of schools, many schools in the area who were who are going to be doing virtual learning.
Yeah,
Well-
may I just add that, I mean, I think we were also, when we sort of, made that estimation, that it was based upon recognizing that some school districts had already purchased Chromebooks and done some of the virtual and during the spring. And so, there were a lot of different moving factors, and then also understanding what the state was providing through their CARES funding too, all came into play in terms of the estimation about the Chromebooks.
Well, that's fine, but it looks like that now that we're having more and more school districts decide that they're going back to in-person learning. And so with that, we're still going to need an additional 4,000 more Chromebooks?
So just as a reminder, the survey indicated, or the results of the survey indicated that there were approximately 13,500 Chromebooks that were needed. So this gets us to about half. So I think it has, that sort of balance between what was the amount that was needed, that was indicated in the survey a couple of months ago, and the reality now of more school districts who are either doing some sort of a hybrid or are going back to in-person.
So that's my question. They're going back to school, so therefore, are you
right,
saying
so this,
that?
This is only half of what they said that they needed back when it was all virtual.
But at that particular point, it was all virtual. And
right.
So, but my question is that now that they are going back to school, you're still saying that we need 4,000 more additional Chromebooks?
Yes, because it's still only meeting the need of what they've indicated was, it's still only meeting half of the need. And even if all of them go back to in-person, we still anticipate that there will be some level of virtual learning that is going to be provided. And so it looks here as though 30 to 40% of the families in the area will stay virtual. So that we're kind of right on target in terms of the 13,500 Chromebooks that were originally indicated in the survey as that was necessary, and what we're providing, which is about half. So it's not going to be completely matching, but it's close.
Yeah, I hear what you're saying. That somehow that just is not logical to me that they would be coming back to school and then you would continue to need more Chromebooks. But that's okay. We'll move forward. Thank you very much, Madam Chair.
You are welcome, Councilwoman Clancy.
Yes, a couple of things. I have had some recent conversations with some folks from the Older Adults Commission who have helped me to understand the importance of digital equity for our older senior citizen populations as well, how internet connectivity can be so important for preventing the social isolation that can happen in older age. I do understand that we have budgeted money through the Humanitarian Relief Program for organizations that are working particularly with older adults, and that some of that money has gone towards addressing digital divides for older adults. And that brings me to my next point about reporting and how a few minutes ago, Councilwoman Days made some important points about reporting, and I think I presume that we are probably in agreement that the two things that are important to all of us on this call is getting money out the door, but also making sure that the money we get out the door is being used for what it's supposed to be used for. And that's where reporting comes in. But I also want to be sensitive to the fact that a lot of these organizations that we're distributing money to are nonprofits that have varying levels of capacity to absorb an influx of funds, but will do it because they know the importance of using these funds to provide a lifeline to the community. Nonprofits have very skeletal staffs because we know how to be efficient and have forced to be efficient with our funding. But that can present some challenges when it comes to reporting. And I would hate for any of our nonprofits to be excluded from receiving some of this money and doing the good work that they do simply because there are some capacity issues with reporting. I would like to hear about how St. Louis County is providing technical assistance to our nonprofits and other agencies when it comes to reporting requirements.
Yes, so thank you. That was a really, really good, important point, and it's something that we've observed not only in the humanitarian relief, but areas, but also just with the small business program that we're going to get to in a bit with the child care relief as well. You know, just the amount of reporting that is necessary for us in St. Louis County as a prime recipient of the funds, you know, certainly necessitates that we do that we're extensive and comprehensive when it comes to reporting. And so many of the recipients of the humanitarian relief program early on, when the funding was originally announced and the awards were announced, there were webinars that were online that went over that provided a lot of technical assistance. There's been a lot of communication and interaction that's been ongoing, partially because the federal government guidelines have been evolving over the course of the past 7 months as well. But we are doing our best to balance, again, what we need to do for compliance purposes as a prime recipient of federal funds with getting the money out of the door and making sure that the reporting requirements that we are issuing to our awardees aren't overly cumbersome and overly burdensome. I'm not sure if Emily or AJ, who are the co-internal leads for the humanitarian relief, want to add to that, but that's certainly something that we're focusing on and have done over the past several months. The technical assistance.
Yeah, Cora, this is AJ, and I'd just like to add that the staff here is readily available to assist with any of those agencies that have exhibited challenges with reporting. We do have one or two that our staff has been working with intimately to make sure that they're in compliance with the reporting piece. So we do have staff on standby waiting to assist those agencies.
Yeah, to echo AJ's comments, each agency has been assigned a staff member, either within CSF or with DHS, and have full and complete access to those staff members for any questions. We're fielding questions on a daily basis, providing webinar support on reporting and compliance. As we receive information, that information also trickles down to the awardees as well.
Thank you. And thank you all for all of the work that you are doing every day above and beyond what you would be doing if we weren't in this crisis. I want to recognize the good work that all of you are doing. Thank you.
Madam Chair?
Yes, Councilwoman Days.
Yeah, one follow-up. I want to thank Councilwoman Nancy for that, because there was mention of the technical assistance with the small business relief. And I'm still getting calls on those particular businesses that have had that. At one time we had a group, and I'm not sure who they were, that were supposed to be answering questions along those lines. What happened to that group? I can't remember. the name skips me as to who they were. Is that still in place?
The group to provide technical assistance for the small businesses?
Yes.
So do you mean like the partnership or Ruben?
No, it was before the partnership came aboard. This group was supposed to answer questions for the Small Business Relief Program. I don't know what happened. They had didn't really have enough training to do that.
I think it was just
it was some kind of a call center or something.
The call center. Like oh, yes, the call center. Okay.
Is that still in place?
Helpline.
Yes, so the call center is my understanding is still been engaged, but their engagement wasn't limited to the SBR program. Originally, that's what was considered, but they really started to field questions just from folks throughout St. Louis County about COVID response. But I can go ahead and move to the SBR program if y'all want, so we can talk about.
Don't do that.
Okay.
Don't do that just yet,
Okay.
because that was what my concern, my train of thought was, that now that we're going into, and you're going to get to that in a minute, to the Muni Relief. I'm having calls on the Muni Relief because that's not clear. I think you have some new manager of that. And so again, you can move to that in a second, but I just want you to kind of put a pin in that. But people are going through these processes and being rejected and, really not knowing where to turn. So it's not just, the not-for-profits that have that concern. All of these entities are having the concerns because there's a lot of paperwork and they don't have the capacity either in many instances to address all of that. So just keep that as you move forward with the economic recovery issue, and then we'll address that. Thank you. Thank you, Madam Chair.
Yeah, if I may, I just want to just really echo that. We've had what I just kind of called an all hands meeting last week with many of the folks that are on this call and that are leading throughout St. Louis County in terms of our COVID response. And one of the things that I asked for in terms of feedback from our county employees and leaders was lessons learned. And for each area, for public health, for humanitarian, even, how we break it down for the economic relief, and then more recently for the Muni Relief, one of the things that was consistent throughout was the need for technical assistance because of the amount of reporting and paperwork that really is both just associated with, again, the federal funds, the fact that the guidelines have been evolving. And so that's something that, to your point, Senator Days, that's something that we heard throughout from public health all the way to Muni Relief, was that a good lesson learned and something that we should be thinking about as we move forward and are thinking long-term about our recovery strategy is really building in the technical assistance that is needed for the community to access and take advantage of these funds. So I just wanted to echo that that's something that we heard from folks.
Okay, thank you.
I had a question.
Councilwoman Gray.
Regarding the digital equity initiative that was Councilwoman Clancy just recently mentioned about the seniors, is there a program for seniors to get access or to get training?
Yes, there's several agencies that were funded specifically around technology and seniors, and so I've got a table that I can provide that has an explanation of each of the agency's programs and the number of seniors that are that it's designed to serve, that I will be happy to share with the committee and the council.
So does that require? Well, I guess you wouldn't know if the agency is coming to their homes, or is it virtual, or if you have to go.
I think it would depend on you know, which agency and their specific program. But again, the table that I've got has a breakdown of that, and you will be able to see which ones, just kind of how they're designing the programs that they're doing to support seniors and their technological needs during this time.
And with regards to the actual awards, humanitarian, SBR, all of those, especially the humanitarian, because some of those were quite large grants. Are they required to present a accounting of how the money was spent, the humanitarian?
Yes.
And the so are you giving them half first?
So it depends on. Yeah, so it depends on which agency. So the child care providers are receiving their full amounts of or awards 100%. The humanitarian relief buckets are receiving half. They receive half up front, and then the rest upon the reporting.
Okay. And I'll wait to get to when we get to SBR for my other question. Thank you.
Are there any other questions from any members of the committee or council? All right, Cora, I think we can move on. Thanks.
Okay, great. Thank you. So, so I'm going to just go, moving on to the economic recovery piece of the response, the St. Louis County CARES response. Just as a reminder, there were really kind of two areas of focus up under this bucket. One was the economic rescue team, and then the other is the SBR program. And so the economic rescue team continues to move forward with their work and their recommendations. I will make sure that we get the most recent survey that I mentioned during the last oversight committee that they were going to be conducting of small businesses, get those results to you. They received the results from the survey, I believe it was last week, or maybe the week, last week. All my weeks are running together. And we will be sure to provide that to the council as well. We're looking into having someone come on for the next oversight committee meeting to do a presentation of their report and the results of the survey and what the recommendations are in terms of the recovery of their recommendations. So that work is continuing to move forward, and it's informed by the results of the the survey that was done last week for small businesses. So I just wanted to mention that to everyone and mention that the work is continuing to move forward, and we'll have a report and a report out in the coming weeks from that group. So now I want to talk about a little bit about the Small Business Relief Program and where we are with that. And so right now, for all of the districts, 100% of the applications that were passing applications have been assigned contract numbers, and approximately 1,500 applications have contracts that have been fully executed to date. There are about 120 that are out to the applicants and are awaiting signature for their execution, and then ultimately the funding that would be transferred to them. And so in total, we are looking at approximately $19.3 million that will be supporting approximately 1,700 small businesses throughout St. Louis County. Now, some of the applicants have elected not to sign their contracts yet for a multitude of reasons, and so there's some ongoing conversations that are occurring with this handful of applicants. And then finally, there are a few applicants who, for whatever reason, accounting or fiscal management have identified as and flagged as possible duplicates or just needing some additional follow-up. But all in all, I wanted to be sure to just look at or mention this for each of the different areas or the districts that we've got approximately or a little over 100 applicants who are failing applicants for, again, a variety of reasons that include duplicates, just sales tax issues about, sales tax revocations, failing affirmations, those sorts of things. And so what we will be doing for each of the failing applicants in each of the county council districts, we will be providing the council members in the respective districts with the list of these applicants, just so that you all can remain informed about who they are and what the reasons and the rationale have been around the ones that have failed. I also want to mention that there are approximately 20 or so that were applicants that were just not based here in St. Louis County. They were based in the city or elsewhere, and so they were not eligible for funding either. But we are continuing to move forward, and I think the best thing to do would be to just share, if I can, if you just give me a moment. Actually, I will answer questions as I pull up this video so that you can hear from a couple of the folks that that were recipients of this funding.
I do have a couple of questions, Madam Chair.
Yes, Councilwoman Days.
All right, I'm looking at completed council approved applications. And I'm looking at the amount of money that has been spent here. It was my understanding that we each had $2.7 million to spend per district. And I'm looking at 1, 2, 3, 4 districts that overspent that amount of money. And one significantly. How did that work? How does that work? I think you're on mute.
Yes, so what we really tried to do, and what the folks that were working on this tried to do, was try to maximize the amount of funding that they would receive. So while there was originally the $2.5 million that was allocated to each district, just in the process of rolling this program out and working out and ironing out several of the kinks that occurred very, very early on. As you recall, we were trying to do what we could to make sure to maximize the amount of funding that was applied for in each district. So some of them and some of the districts, and you'll see just kind of the difference in the numbers as well in terms of the number of folks that applied per district. It just really varied. But the SBR team worked really hard to try to make sure that everybody that applied, up to $15,000 were able to get the maximum amount of that $15,000 in grant funding that was cap for each of the small businesses. So, for instance, in District 3, Council District 3, for example, with nearly 278 applicants that were approved, the folks that were in that district and the amount that was requested could have clearly exceeded the amount that was requested on average per applicant in, let's say, District 4, for example.
Well, let me just be very clear, because for the beginning of this program, I have asked who applied. In my district, I wanted to know who applied and how much did they apply, how much money did they ask for. And to this date, I still have not received that information. So I don't know who these 214 people are. I know that some of the people that applied for the 15, they got $500. Some of them got $1,000. And so that was the reason why I wanted to know who these people were that applied from the beginning, because 214 doesn't really tell me anything. And so that's why I wanted that number. And I've been asking for that number for months and still have not gotten it. And so I know that probably there are many more applicants out there that could probably have utilized this money, but for some reason they got dropped. And I don't know why. And they asked me, I don't know why either. So it puts me at a disadvantage in trying to address my constituents in why they were not able to receive whatever, or they were to receive less. I don't have that information. And so I know you mentioned some kind of a report, but you got 100% here. So it's not an opportunity for them to get anything at this particular point. The program is closed. Is that correct?
That's correct. The program is closed.
Okay, so
the date was September 25th for the last day of the program.
Right, and so that means that regardless of this is the maximum that I'm going to be able to access. But it puts me at a complete disadvantage in not being able to get that information. And I don't know why I couldn't get it. Nobody's explained that to me, but that's a source of irritation for me. And I kind of want you to know that. So thank you, Madam Chair.
I will make sure that we resend. So I know that the batches that come out every week have some of the information and a breakdown of all of the different districts, and so I will make sure that we go back and get that out to you, Senator, just to make sure that you are able to get that.
But the application goes to the accounting people. I guess that's the way it still goes. And so there's a cutoff there. That's not my issue. I want to know from the beginning who applied and what did they apply for. It's very simple. So I appreciate your willingness to go back and do that. So I will look at that when I get that information. Okay.
Okay, will do.
Thank you.
All right, great. Anyone else before we move on?
Madam Chair.
Yes, Councilman Tracus.
Thank you. Walker, can you explain for me why your chart redacts information pertaining to basically two districts, 6 and 7, at least?
Yeah, there's some weird gray box that's covering up a piece of the screen. You're no longer sharing your screen now, Cora, just so you know.
I'm glad someone brought that up. I thought that was just an issue on my end.
Me too.
Okay, yeah, if
me
there's
too.
a redaction, that's me and my my technological prowess or lack thereof. Let me see if I can try to if I do it like this, if y'all are able to see it, and let me try to share my screen.
Which is why, ladies and gentlemen, I do old school and I print mine out. So I'm good. Oh, wow.
Okay, let's see if I do it this. Are you able to see?
Yes, that's
Now?
move the thing. And then
Okay.
I just find it rather interesting. If I'm looking at the math properly, got 104 total failing applications. Is that right?
Correct.
Okay.
That were in St. Louis County.
Right. And fully a third of those are in 2 districts and 7, correct?
That's exactly right, yes.
Yeah. Now, I've got some issues with the way this program was run from the outset. It's almost a poster child for ineptitude. I've got at least one and perhaps more than that applicants in my district that have been told not once, but several times that their application was complete, pending, and now you're telling us that this program is closed, and so this applicant is foreclosed from receiving any monies. Am I hearing that correctly?
We're not accepting any more applications. There were several folks who, who over the course of several months, would come back and say that they never received any communication or that sort of thing. And so the SBR team was trying to work with people, you know, to accept applications and accept additional information so that we could get the money out the door to folks. But we're not accepting any more people that are coming after September 25th to provide that additional information.
All right, so we're clear then, my constituents who have submitted their applications before that date, that is September 25th, those applications are still pending, and they can expect an answer definitively with respect to those applications forthcoming?
Yes, sir.
Okay, because I've got one in particular that's dragged on for months. In fact, we communicated with the county executive this morning about that very application. That's probably perhaps into double digits now, the number of times my office has communicated with the administration about this particular application. My frustration is beyond the pale at this point, and I need some action on that application. I'll follow up with you directly.
Okay, yes.
Thank you.
That's absolutely.
Thank you, Madam Chair. That's all I have.
Thank you, Councilman.
All right, I'm gonna just try to share the video if I can.
Friends, and we're so excited
sorry.
and so happy for them.
Let me rewind it.
Hi,
Guess I can't mute myself.
Blair, and I am the owner of ICD African American Children Bookstore, and I am the proud recipient of the St. Louis County Tier Small Business Grant, and we're so excited and so happy for that. Thank you. The grant that we have received will help us tremendously, especially during these times. We have suppliers that we're trying to pay. We're currently closed and we're doing online business, so it will also support us being open, or reopen, I should say, in a month or so. So we're trying to find an open date, and that would help us purchase products so that we can keep our customers safe. Our children can go from kindergarten to college and never see a book that have characters that look like that. The picture tells 1,000 words, right? So if I don't see pictures and I don't hear my story, I don't think I have any sort of relevance. I'm not important. So it's really important for our children to see ourselves, to see themselves in books, in stories, whether it's fiction or nonfiction. We would love to, to continue to be that resource to our community. And we're so thankful to St. Louis for even allowing us to apply for this grant and giving us this grant. And so we're thankful. I'm Jennifer Miller with KidSmart, and KidSmart was founded in 2000. Opened our doors in 2002, and we serve tens of thousands of kids in St. Louis County, kids who are living in poverty and lacking basic tools that they need to be able to learn and succeed in school. We are the proud recipients of the St. Louis County CARES Small Business Grant. Absolutely vital to this organization. It is a local organization. We're right here in St. Louis County. We're serving St. Louis County kids. We've been around for almost 2 decades. Huge impact across the region. This year, what we've seen with COVID-19 is our traditional annual revenue is down 70%, but the need is up more than double because kids need to be equipped not only in the classroom to learn and succeed, but also at home. So we have, during the first 10 weeks of the COVID-19 emergency response, we pushed out $2 million worth of school supplies to equip kids for distance home learning, and then back to school. Did that again, and now the kids are going back to brick. We're seeing a third wave of just exponential need during the same time when our traditional revenue streams are have just drastically decreased. So we're truly grateful, and this really makes an incredible difference, not only for the organization, but most importantly for the tens of thousands of kids right here in St. Louis County who the organization serves. So thank you.
Hi, my name is Sarah, and I am one of the co-founders of Switchgrass Spirits. We're a distillery. We make whiskey and apple brandy on the north side of St. Louis in Wellston. And we are a recipient of the St. Louis County CARES Small Business Grant. It was really clear that the county was trying to get the applications out and the money to small businesses as quickly as they could. Everyone I spoke to was so kind and really clear that they really wanted my business to get the support that they needed. Whenever I would call the county, if I made a mistake or if I had a question, just helping me right away. I cried on one of the calls because with COVID, it felt like it's just one piece of bad news after another. And when I spoke to the county and the CARES Small Business Grant, it was like the first time I'd had good news. And I had someone there who could tell me something positive and really give me support in a time when all supports feel like they're being knocked out from under you. And I told the woman on the phone, I was like, I'm tearing up a little bit. This is pretty overwhelming to have this support. She was really kind. She was like, well, this is why we're here. What makes our day too. We're here to help you guys. So it's been a great experience. And we really appreciate it. I don't want to cry now, but yeah, it's meant a lot to them.
And so obviously we want to make sure that everyone can experience this sort of help and support. And so Councilman Tracus and Councilwoman Days, we will be sure to follow up with you to make sure that we are able to address your specific folks that you've got questions about and get the funding to them as well. I am going to go ahead and get back to my presentation. We've got a couple of final things to discuss with you this morning. So the Municipal Relief Program, which had been launched over the past in the past 2 weeks. September 15th was when the notice of funding opportunity was issued. And again, just as a reminder, that is this municipal relief program set aside $47 million in reserves to provide financial assistance to the local municipalities, 88 municipalities that are located in St. Louis County for any sort of costs or expenses related to COVID. So just, you know, this is just another example of really, one, trying to be expeditious in getting funds out of the door, and two, local governments who are already experiencing a lot of challenges related to revenue, which I understand and know that you all will be beginning your budget work very soon, and so the timing of this is certainly appropriate. But you know, the real sort of challenge with this again has been the federal guidance. Just a week after the program was launched, there was new guidance that came out from the OIG Treasury Department that made a pretty significant shift in the amount of and the reporting that was required to be compliant with the federal rules and guidelines. And so just again, as a reminder, there's $69 approximately per capita, so per person in each of the 88 municipalities in St. Louis County. And they could and are eligible to apply for funding for COVID-19 related expenses, including things like public safety and public health, payroll expenses, as well as just medical expenses, equipment. There's a whole host or there's a list of eligible expenses that the municipalities are able to apply for. But one of the things that we really are working to do, and what we've learned from just all the lessons over these past six months, you know, the first case of COVID in Missouri was 7 months ago, but the CRF funding didn't come to St. Louis County until April 22nd, and so it's been just over about 6 months now. And again, like I said, up until a couple of weeks ago, the federal guidelines around acceptable uses of the funds, what was required in terms of reporting and compliance was still being updated. And so what we have done, and the way that this program is designed, is really trying to balance, again, both of those sorts of realities of the compliance and just the reality of being a local government that is in need of funding. And so based on that per capita amount, we've broken up the amount that was allocated, we've broken up the application process into two primary steps. The first step is just a preliminary request, which we are just getting basic information about the municipality, some basic certification from them, verifying that they're eligible for the funds, and then they're issued a notice of award and funding agreement, and will be able to receive 50% of the allocated amount of funding upfront. As of this morning, we've had 22 different municipalities who have submitted the preliminary request thus far for a total of about $16.5 million. And we are continuing to work with the remaining municipalities to provide technical assistance and support so that they can avail themselves of this funding opportunity. The second step of the application process, and this is something that was really clarified by the update in the OIG guidelines about the reporting requirements, is the supporting documentation that is necessary to substantiate the amount that is allocated to the municipality, the 50% that they're originally getting, and then the additional 50% for their full funding amount. Again, the OIG change was pretty significant in that municipalities are no longer required to to explain why certain expenses related to public safety or public health payroll are substantially dedicated to the COVID-19 response, and instead the presumption that was originally included in the FAQ that came out from the Treasury Department, it was clarified that there's no sort of additional reporting that has to be if a municipality makes that presumption in order to prove, for lack of a better word, that public health and public safety related expenses are substantially dedicated, payroll expenses are substantially dedicated to COVID. So that, again, is a really, really significant change. And like I said, it happened over, the week after the program was launched. And so we have extended the deadline for this preliminary request to this Friday because of that important change. And we are continuing to host weekly webinars and Q&A sessions, as well as are targeting specific areas or groups that might want additional support and some dedicated technical assistance for their specific members or local governments. And so just trying to continue to work through that. And just this is the team that we've got here. So Joan Kelly Horn, who's been brought on as the manager of the program, and then we've got a couple of other folks, Ethel Bynum and then Kathy Raymer, who's one of the volunteers from the community that's been working on working with St. Louis County over the course of these past few months. Is also providing support and contributing her time to move this program forward. Additionally, there is a third-party administrator. I know that we mentioned this during the last Oversight Committee meeting. They have been engaged in, I think there was that started at 11 with that group that is being brought on to both help with the administration of this program, but also help to provide technical assistance both to the municipalities as well as St. Louis County for ways in which we can maximize the federal funding that that we have through the CRF, the Coronavirus Relief Funds dollars. And so we are looking at a timeline of September 15th, which is when the program was launched, through November 13th. And so, again, the first step for municipalities to receive 50% of their allocation is the deadline is this Friday. And then the second step, which is the requirement that the municipalities submit the necessary documentation, receipts, et cetera, to substantiate the allocated amount that they're requesting. The deadline for that is November 13th. And along those same lines, again, because of that very important and very significant change that was made from the OIG's reporting FAQ that was put out a couple of weeks ago, St. Louis County is also in the process of looking at and making a determination and continuing to monitor what sort of funds related to our own response can be assigned to CRF, whether or not it should be assigned to FEMA or what the appropriate balance is to try to maximize the dollars and be just be as fiscally responsible as possible. And so we are also going to be using that same sort of time frame with fiscal management and in budget and administration to make those decisions as well. And so back to the very beginning slide where we moved from the $16.5 million for the county employee and constituent safety bucket up to the $21.4 million. That is that $69 per capita amount that is applied to the 310,000 folks in St. Louis County, unincorporated St. Louis County, according to the 2010 census. And so just by way of budget, and this is the overall amount and a breakdown of where we are in all of the different buckets that you can see here. And so again, it reflects the increase for the county employee and constituent safety area that matches this $69 approximately per capita allocation that the 88 municipalities received in the municipal reserve bucket. And I am going to stop to answer any questions that folks might have. In the interest of time, I want to make sure that that I've paused to give folks an opportunity to answer any questions or to ask any questions.
Madam Chair, if none of the committee members have a question, I do.
Councilwoman Days in Gray, should I let Councilman Fitch have the floor? All right, I think that's a yes to you, Councilman Fitch.
Thank you, ma'am. Cora, did you get my letter about the unincorporated areas?
Yes.
I never received a response from that. So what
you will be receiving one after this is done, sir.
Okay, because what I noticed is, I heard what you just said, but originally we had $16.5 million allotted to that category. Now you've added a little less than $5 million to that. So we had an answer of how much we were going to spend before the decision came down about the municipal money, and all we've added is $5 million. Wouldn't the right number to be 310,000 would be more than $20 million in addition to that 16.5?
So I want to just mention that, like, when we put that 16.5 in, we also put the $10 million in reserves in the unbudgeted reserves with the idea and the expectation that we might increase it up to that amount. If you look at, I don't have it here, but I'll be sure to share it with you. If you look at the sorts of expenses that that we are determining are considered eligible expenses under the municipal relief program, this really is kind of that it's an apples to apples sort of comparison between what the municipalities are able to receive reimbursement for, essentially, is what this is, receive reimbursement for, and what St. Louis County is going to be receiving reimbursement for as well. And so it's very, let me go back here. It's very,
it just looks to me like we've only added $5 million after the Treasury Department said it could be used for public safety expenses, and it didn't have to be specifically COVID related. We only added $5 million to what we were already allocating. So it really looks to me like the unincorporated area is getting shorted significantly compared to the $47 million that are going to the incorporated cities.
Yeah, so I will, so I want to, it's a little bit complicated, and so I'll explain it all in the letter, but again, it really is, it is similar, just the per capita amount. The important difference is, if you look back at this revised draft budget, is really around the public health and health response, and the fact that St. Louis County is the and the Department of Public Health is the only health agency and public health agency that is able to provide that, these sorts of supports.
Yeah,
I get that.
I get that. But my issue is that money is being spent everywhere in the county. So are we taking the allotment for our 310,000 unincorporated residents and spreading it out in all of these different budgets throughout the county? Because Creve Coeur's not doing that. They're taking their money and keeping their money. Florissant's not doing that. So what are we doing to protect and make sure that the unincorporated residents of the county are getting the same benefit that the municipal residents are?
Yeah, I'll get that. I can get that breakdown of that number to you. But I guess the best answer and the easiest answer would be we are trying to maximize the dollars to the greatest extent possible, which is also why we've brought on the third-party administrator, so that we can really figure out, because it's a complex set of funding areas and opportunities. Again, this is just the 100, and it's weird to say just, but this discussion and this budget that you see here is only for the coronavirus relief funds money, the $173.5 million that was in that specific section of the 800-page or so CARES Act. There's a lot of additional funding that St. Louis County has received and is eligible to receive from CARES that isn't limited to this. And so I think once we'll on, and once you see it, like, you'll see that this really is an equitable sort of a distribution across the board. And I can assure you that the folks that are in unincorporated are not being at all shortchanged. But we want to, do what we can to try to support the 88 other municipalities who didn't receive anything from either the state or from the federal government.
Okay, I think I know the answer, so I'll look forward to your response. Thank you, Madam Chair.
Madam Chair.
Councilwoman Day.
Thank you. In continuing that line of questioning, I guess I'm interested in how much will that be that you're saying that we could possibly get from another source, and when will that happen? As this is a council that only deals with the unincorporated areas, and yet this funding does not seem to be targeting or even going to that, or a limited amount that's going to that. That is my question, given the number of people that we have in the situation that exists in the unincorporated areas. I'm not sure if you're answering that question or you have that, but when will this happen? And how much?
Yeah, so again, I want to just re-emphasize that because of the nature of this crisis and the fact that it is a public health epidemic or public health pandemic, and the Department of Public Health is the only Department of Public Health that is providing healthcare services and public health services to all residents of St. Louis County, that it is not quite as simple as, we're only providing services for the 310,000 folks that live in unincorporated St. Louis. To your question, or to answer your question about when is the decision and all that going to be made, so part of it's going to be discussed during the budget today, but just going back to that timeline that I had, or that I showed you with the municipal relief program, we're looking at mid-November for getting these final sorts of decisions. Well, actually, for getting all of the information, all the reporting in from all of the funds that have gone out, and then looking over the course of the next couple of weeks to determine where should we book our own expenses and whether or not it should go to CRF, should it go to FEMA, really trying to figure out how to get the right mix to make sure that the money is being used in the most responsible way as possible. But we're having and the fiscal management folks, the budget folks, they will be talking about that in 42 short minutes during the budget presentation that's beginning at 1, but they're looking at this on a monthly basis. All of our different departments that are in St. Louis County and under the county executive have reported, they have to report and keep track of and keep an accounting of all of their expenditures, their payroll, all of that sort of stuff. And that's happening and being looked at on a monthly basis. And we are projected to have some final determinations about that come mid to late November. Again, the third-party administrator was selected, and I think, I'm not sure if it's public knowledge yet, but they are in the process of finalizing, the agreements, and that is happening today, is my understanding. And so we're looking at making that determination and utilizing their expertise by the mid to late November.
So you can't tell, because that was going to be my next question. You can't tell us who the third party administrator is at this point.
I don't know if I can.
And are they being paid?
Yes, this is the firm. It was an outside consulting firm. It went through a formalized selection, bidding process and all that. But I just don't know if I can share it publicly.
So, and the other thing is that you're asking the munis to be able to respond in 1 month. I think I heard you say the middle of November they would be
correct.
And then so in less than a month's time, they're going to be expected to turn around and respond to whatever you're asking them to do. Is that what I heard?
Yes, we're asking them for the receipts to support the amount that of funding that was allocated to them for them to get the full 100% of the funding that was allocated.
Okay. And before we run out of time, I did want to say to you that when in the very first slide that we had the allocations of 51.6 million to 24.1, I came up with $184.7 million. I could be wrong. My adding may not be correct, but that's the number I came up with, which is more than 173.5. I just wanted to make sure that y'all knew that, and maybe we need to recheck those numbers, or I can recheck mine. Okay. Thank you, Madam Chair.
Thank you.
Chairwoman?
Yes, Councilwoman Clancy.
One question, interesting conversation about the unincorporated areas of St. Louis County. Is the St. Louis County Police Department receiving any CARES Act money right now? And this question would be for Cora, unless there's someone else better suited to answer the question.
I thought that was directed towards the chairwoman.
So my question is, has the St. Louis County Police Department received any CARES Act money?
I'm not sure, but I can let you know.
Okay. I believe that they have received some of it, and I just, I understand, some of the questions and where they might be coming from about the municipal program and what about unincorporated areas. I don't understand how we would, include unincorporated areas into a municipal program. And we also have to consider how the St. Louis County Police Department serves the unincorporated areas of St. Louis County. So I think it's important to understand whether or not St. Louis County Police Department has already received some CARES Act money, and whether they have or haven't, if they have a proposal for any additional or perhaps not additional CARES Act money. I do think that there is a benefit from investing in our municipalities and the CARES Act money that's going towards public safety in our municipalities for all of us, even those that live in unincorporated St. Louis County, because we don't stick to our little bubbles in our municipalities, and everyone tends to pass through areas that are incorporated, and therefore will benefit from services like public safety and emergency services as well. So I'm struggling a little bit with some of the either or thinking I'm seeing here.
Well, thank you for raising that. One thing that I did just want to add, and again, this is why we have, and really the fiscal management folks in the Department of Administration recognized this early on, and the timing is working out in a way that I think will be beneficial for everyone in St. Louis County, is a very, very important change and update in the federal guidance that said that the coronavirus relief funds money that we have received can be used for the FEMA match. So FEMA can cover up to 75% of eligible expenditures and costs related to our response. There's no cap on it. There's no sort of limit in terms of when that money can be available and all of that. But it wasn't clear with the initial guidance that came out. It wasn't clear whether or not the CRF funds that we've received could be used to match the FEMA funds. In fact, the federal guidance actually said that that coronavirus relief funds money couldn't be used to cover expenses that could otherwise be paid for by other federal grant programs. So that 75% to 25% ratio with FEMA funds versus CRF funds is a pretty significant change. So even if the police department had been booking certain expenses to CARES Act and the coronavirus relief fund, it might be more prudent financially for the money to be booked to FEMA and then to use that 25% CRF funds for the matching. And so that's why we've gotten that third-party administrator and that expert that is being brought in to really help us figure out what the right reimbursement mix, for lack of a better word, is for using this money responsibly. So that's just where we are, and that's what we're continuing to work through.
Madam Chair.
Yes, Councilman Fitch.
Cora, can I go back just for a second briefly? Looking at the St. Louis Corona website this morning, $54.7 million of funds have been issued, checks out, allocated 24.5. So that comes up to $79.2 million of the 173. So those have been issued or allocated. Well, I think I heard the county executive say the other day there's only $5 million left in this fund to spend. However, that's not what the Corona STL Corona website says. There's still $94 million that have not been either issued or allocated. Maybe that money's been put into a bucket and said, we plan to spend it over here. Are my numbers right?
Hi, yes, thank you. That's a really, I'm glad that you brought that point up, Councilman Fitch. For the purposes of the OIG reporting, there's a third, even fourth category. It's about obligated spending. And so let me see if I can show this slide again. But the point is that
I mean, if you just look at the website while you're looking that up, it still shows that less than half of the money we have allocated is left that we got from the federal government is to be spent or allocated. So it's taken us 6 months to spend $79 million. We have 11 weeks left before it expires, and we have 94 million left to still spend, according to our own website.
But yes, so that's money that is either checks that have been issued or checks that are in process. But again, I think the important distinction is obligated, and I'm trying to show this slide here. I will make sure to send it to everyone. But if you can see here, the only thing that is really unobligated at this point is that approximately $5 million. Everything else is obligated, which is also why we are looking at that November, like that mid-November date, to receive either the reports or the documentation from all of the folks to whom we have obligated this fund. And this funding, so that we can know just how much is actually going to be left over, and then what additional funds we in St. Louis County, and St. Louis County government might be able to shift or transfer over into our funds directly, so that we're able to use the money or incur the costs by the end of the year per the deadline. So we've obligated pretty much everything, and I think you will see on the report that we'll be providing to the OIG next week. That's when the next deadline is for the reporting, that the amount that we're actually reporting to the OIG is pretty close to that $173 million.
Why wouldn't we have a category on the STL Corona website that shows the obligated funds as well? Because you're just showing.
I'm sure we can talk to IT and get them to do that. Again, you're talking to the person that couldn't figure out how to get the video started, so I can't really answer that question. But I will be sure to talk to IT to reflect that, or see if there's a way that we can reflect that.
Can I ask a clarifying question about that, Madam Chair?
Councilwoman Tracus may be ahead of you.
Okay.
I'll defer to Councilwoman Clancy and wait until she's finished.
Okay,
well,
great.
Are you, Cora, are you using the term obligated and allocated synonymously?
No, I'm not.
Okay, then I'm okay.
It's similar, but obligated. There's a definition of obligated under the OIG Treasury reporting guidelines that came out that I'm talking about. So it's similar, but I'm not using, at least in my head, I'm not using them synonymously. But yeah, I think it's the same sort of idea.
Okay, because I can understand how there's a certain, 163 million has been allocated or, earmarked for different buckets and strategies and everything. And only 75,000 roughly in checks have either been issued or in process, because you are still, because you are meeting different needs that are evolving every day, still setting up systems and processes, as you should, to get more of those dollars into the place where they're being checks issued and checks in process. So I really want to underscore all of the work that goes into this. And I think that, and sometimes the numbers don't tell the full story. I know we want the quick, hard data and numbers, but there is so much work going into this, as it should be, because we have so much due diligence to do with the federal government and the county residents to make sure that we're doing this the right way. So let's also consider that as we look at these numbers on the Corona website. And, to Councilman Fitch's point, as much as we can provide on that website to be more explicit about that, I think would be very helpful.
Yeah, absolutely. But just to try to clarify, so the unbudgeted reserve that has been allocated, that was $10 million was originally allocated, but we, as we discussed, moved that over, and now we've got about $5 million. that would not be considered obligated for the purposes of reporting to the OIG, but the $47 million that we have announced in funding for the municipal relief program that we've also allocated would be considered obligated under the OIG report. So it's a small nuance, but they're pretty similar. They're pretty similar in concept.
Councilman Tracus, did you want to pick it up?
Yes, thank you, Madam Chair. I just wanted to respond to Councilwoman Clancy's statement regarding the distribution of funds distribution of funds into unincorporated areas of unincorporated St. Louis County. And I agree with Councilman Fitch. I do believe that equity requires a per capita distribution of funds. So if we're going to set aside a specified number for municipalities, it's important that unincorporated St. Louis County be treated in kind. The reason we have a boundary commission today is because previous county executives were so concerned by the loss of tax revenue to municipalities, they made it virtually impossible, or he made it virtually impossible to incorporate in St. Louis County any further. So the idea somehow that because we receive St. Louis County protection for our citizens in unincorporated county doesn't begin to address the question of an equitable distribution of these funds so that people in unincorporated areas are treated equally with their citizen partners in incorporated areas in municipalities. So I just wanted to make that point from the perspective of someone who represents a district that's 95% or more unincorporated. Thank you, Madam Chair.
Madam Chair,
Councilwoman Days.
I had one last question regarding that unincorporated. We have first responders and firefighters in that are not attached to a municipality. How are they compensated with this CARES funds? How are they receiving monies for that?
So let me make sure I understand. So are you talking about like fire protection districts and things like that? Yeah, we haven't allocated anything. There's several political subdivisions that I guess we could have allocated funding for from this, but unfortunately we weren't able to allocate something for those specific fire protection districts. Now, if they contract with municipalities, right? They could get reimbursed that way, but that's just something that we weren't able to account for or include in this go round.
So if they're handling COVID related issues, they are not part of a municipality. I don't know if you call it on call or whenever the need is there. And they could very well be in an area that is unincorporated. You're saying that they don't get anything.
We have not allocated anything to them at this point in time. No.
I do find that troubling. I do find that extremely troubling.
Yeah, there are a lot of challenges.
They're essentially doing the same thing that a first responder will be doing within a municipality, and yet you just tell them, so too bad, you're out of luck. I guess that's what I'm hearing. Is that right?
I'm telling you that we haven't allocated any money to them at this point in time. That doesn't mean that we can't, but I'm just saying that we haven't done it at this point in time yet. So that could be something that we can look at. I will say though that it can start to get tricky, but I have seen in other areas and other places that the definition of political subdivision has included, everything that is considered a political subdivision, all the way down to libraries that people could apply for funding for. Right now, the municipal relief program is only limited to municipalities in terms of the definition of political subdivision.
Well, I know that we have some reserve. I am not going to, at this particular point, move that we put that there, but I am very troubled that these people are just out of luck. That doesn't make any sense to me at all. And they are still addressing a need, a COVID need in St. Louis County. So I'm just gonna.
Yeah, we can certainly take a look at it. We can certainly take a look at it.
Pushing that issue. I'm just laying that now. And it's just not a per capita. I'm looking at the first responders, and they are in unincorporated areas. And so I'm going to leave it at that. Thank you, Madam Chair.
Thank you, Councilwoman Days. Are there any other questions? Comments? All right. I think that we have no public comments today. So this brings us to the end of our agenda, and I would certainly entertain a motion to adjourn. I can read your lips.
So boo.
Do I have a second?
I can't get it right.
I think Councilwoman Gray's gone. So I'll second my motion, and this meeting is adjourned. We'll see you all shortly.